Assalamualaikum and hi everyone. My name is Kamilia and today I will talk about attention deficit hyperactivity disorder or also known as ADHD. What is attention deficit hyperactivity disorder or ADHD? It is a heterogeneous behavioral disorder of uncertain cause that always is evident in childhood but that typically persists through adolescence and for some into adulthood. The prevalence of ADHD subtypes may differ according to the source of referral. However, the CDC estimates 4.4 million youth ages 4 to 17 have been diagnosed with ADHD by a healthcare professional. And as of 2003, 2.5 million youth ages 4 to 17 are currently receiving medication treatment for the disorder. In 2003, 7.8 of school-aged children were reported to have an ADHD diagnosis by their own parents. There are three types of ADHD that is hyperactive, inattentive, and also combined. For hyperactive, one person may talk very fast and talk a lot. They can also be mental and also have the need to move around a lot and always be on the go. For inattentive, one person may daydream a lot and appear not to be listening to other person when they are talking, and also they need reminders to constantly or avoid them forgetting anything. For combined, they may experience both hyperactivity and also inattentive in a very intense force or motion. What are the symptoms of ADHD? Well, the symptoms vary in degree of impairment, frequency of occurrence, and pervasiveness across settings. They must occur often and across multiple settings, such as at school or during playtime, at home, and daycare. The symptoms must persist for at least 6 months to a degree that is maladaptive and that subsequently interferes with all occupational activities, including self care, academic performance, and peer relationships. There are a few types of symptoms such as inattention, hyperactivity, impulsivity, and others. So, inattention, one person may have failure to attend to details. They may also have difficulty sustaining attention during playtime, and inability to listen actively to instructions or conversation, and have difficulty organizing tasks and avoidance of tasks. For hyperactivity, one person may have frequent fidgeting, inability to sit where remaining seated is expected, have difficulty playing quietly, excessively talking, and being constantly on the go. For impulsivity, one may have an inability to wait one's turn, frequent and incessant interruptions, blurting out of answers before a question is asked. For others, they may also have low frustration tolerance, sleep disorders, bossiness, excessive and frequent demands for attention, malleability, demoralization, dysphoria, peer rejection, and poor self esteem. To know if your child or an adult is having ADHD. So in children, your child must have 6 or more symptoms of inattentiveness or 6 or more symptoms of hyperactivity and impulsiveness. So to be diagnosed with ADHD, your child must also have been displaying symptoms continuously for at least 6 months. Uh, they may also start to show symptoms before the age of 12 and been showing symptoms in at least two different settings, for example, at home and at school, and rule out the possibility that the behavior is just a reaction to certain teachers or to a parental control, and symptoms that make their lives considerably more difficult on a social, academic, and occupational level. The symptoms may also not just part of a developmental disorder or any difficult phase and are not better accounted for any other condition. Whereas for adults, in some cases, an adult may be diagnosed with ADHD if they have 5 or more symptoms of inattentiveness or 5 or more symptoms of hyperactivity and impulsiveness listed in diagnostic criteria for children with ADHD. So, for an adult to be diagnosed with ADHD, their symptoms should also have a moderate effect on different areas of their lives, such as underachieving at work or in education, driving dangerously, difficulty making or keeping friends, and difficulty in relationships with partners. These are some of the treatments that can be done if your child or someone is having ADHD. So, one of them is behavior therapy. Behavior therapy is a treatment option that can help reduce these behaviors. It is often helpful to start behavior as soon as a diagnosis is made. So, the goals of behavior therapy are to learn and to strengthen positive behaviors and eliminate unwanted or problem behaviors. Behavior therapy for ADHD can include parent training in behavior management, behavior therapy with children, and behavioral interventions in the classroom. So, these approaches can also be used together. For children who attend early childhood programs, it is usually most effective if parents and educators work together to help the child. So, secondly, is psychotherapy. So, what is psychotherapy? Psychotherapy is a type of treatment of mental health conditions and emotional difficulties. There are several types of psychotherapy that someone with ADHD can receive. The most effective type of therapy will depend on the person, their symptoms, their age, and other factors such as coexisting mental health conditions. So, therapy that for ADHD can include CBT, mindfulness, family therapy, and group therapy. So, what are the benefits of psychotherapy? One of them is fewer side effects than ADHD medication, which can include sleep problems, changes in appetite, and headaches. The potential for a greater effect of symptoms than ADHD medication alone. It is also can give tailored support and advice. It is also an opportunity to develop coping skills for stress and situations that will occur in daily life and also improve communication skills. There are three types of medications that can be taken if you have ADHD. First is stimulants, second is anti-stimulants, and third is antidepressants. For stimulants, it is the usual prescription if you have ADHD that is prescribed by your healthcare providers. So one of the name of the brands is Vocalin or Desoxyn. So there are two forms of stimulants, that is short acting and intermediate acting or long acting. For anti-stimulants, you are going to be prescribed if only the stimulants are effective or you have intolerable side effects from stimulants, and also if your healthcare providers try to pair it to increase effectiveness of stimulants and anti-stimulants. So name of the brands are such as Calbri or Intunif. For antidepressants, it is prescribed for ADHD that can work on the dopamine and norepinephrine levels in brain. So one of the brand names are Wellbutrin or Pamelor. These are some of the comorbidities if you have ADHD. So one of them is depression, anxiety, obsessive compulsive disorder or OCD, oppositional defiant disorder or ODD, learning disabilities, language disabilities, and fine and gross motor difficulties. That is all from me. Thank you. Bye bye.